My name is Jamaal. I am a professional barber here in the city of Portland. I am also a barbershop owner and also barber school founder. Um, this COVID-19 situation, pandemic, tragedy for a lot of folks has, impacted us all in a very big way. And so it's very important that we have a conversation, man. And who better to have a conversation with than medical professionals that truly understand what this virus is all about. So we all came together today to share with you this much valued information. So I'd like for them to introduce themselves.
I'm Dr. Jill Ginsberg. I'm a family physician in Portland, Oregon. I'm the medical director of the North by Northeast Community Health Center, where we have the Cuts and Checks hypertension program in 5 barbershops.
Dr. Kenji Taylor. I'm a family physician and faculty researcher at Stanford School of Medicine. Also founder of a barbershop-based hypertension screening program called the Cut Hypertension Program, with chapters in Philadelphia, Atlanta, and now the California Bay Area. Thanks for having me.
Yes, thanks for both of you for making yourselves available and bringing this together. Thanks for having me. I think we all know that this has been a very impactful time for a lot of people. Myself, like I said, being a shop owner and a school owner, I have 4 storefronts that I manage businesses in, and we've had to deal with those being shut down as one big impact. We were mandatory, to shut down or mandated to shut down at a particular time when the virus kicked in our city, which affected a lot of lives. Not only did it affect the businesses, but it affected the lives of the people that actually did business at our barbershops, and also the students that are part of our school. And so not only were they not able to continue what they do for a living or continue to strive for the goal of becoming a professional barber, but they also had to deal with keeping themselves safe and having to learn how to deal with this virus, inside our face-to-face setting that we deal with. And so there was a lot that had to be changed, a lot that had to be learned, and still yet a lot that needs to be learned still. And so having Dr. Jill and Dr. Taylor here with us today, we're gonna get even deeper into this virus so we can see where we're at today and how to go forward, to keep each other, and how to go forward to keep each other safe. So that's what our conversation is going to be about today. So first off, though, I want to talk about our partnerships. Can we get into that a little bit?
Sure. So we, the Cuts and Checks program has been going for over 5 years, and here in Portland. And a couple of years ago, I knew that there were other people doing this work around the country, but we hadn't really connected with other folks. And then a couple of years ago, I connected with Dr. Kenji, and we started just talking about our different programs and some of the other work going on around the country. And we came up with this idea to form a national network of folks doing this barbershop health work. So, and that has culminated in, we had a session in October, which was unfortunately had to be held virtually, but we had 40 people from around the country representing 8 different programs. And we all got together and talked about our different goals and dreams for our programs. And we're going to do that again a couple more times in the coming year.
That's amazing. And like I said earlier, I am a proud partner of the Cuts and Checks program here in Northeast Portland. We work very close with North by Northeast within our barbershop and also in our school. The school level is amazing. We're able to, impart in the students the importance of neighborhood health and just health in the Black community as a whole, and how as a professional barber, we can be impactful in our space and dealing with our clients in our community. So I really enjoy working with Dr. Jill and Cuts and Checks. It's an amazing program. So yeah. on to the next. Dr. Taylor.
Through our national convening and that network of barbers across the country, we were able to survey 109 barbers from 40 different states. And we found that more than 70% of the barbers that we had surveyed were already engaged in health outreach. And the overwhelming majority had been severely financially impacted by the shelter in place or stay at home orders as a result of COVID-19. And so we know that not only were barbers impacted by this financially, few were prepared to bear the brunt of that impact. And less than half of them thought that they would even qualify for government assistance. We found that the vast majority were already providing some form of health education and outreach into the Black community, and continue to be interested even more so in providing these services, like information on how to prevent the spread of COVID. And I just want to, really acknowledge and recognize Dr. Joe and Jamaal, yourself, and all the other barbers across the country who've been really engaging in this kind of work and helping us get the message out there. So between our convening and the survey, the message is really clear. Barbers were telling us there was a need for a trusted source of information, specifically around COVID. And we are really hoping to provide some of that support today.
Absolutely. Yeah, I'm definitely thankful that I've been able to play a part in educating my community in regards to how we can stay safe, while dealing with this virus, and allowing people, like you said, we were out of work for quite some time in our profession, so being able to get back to work safely, very important on both sides. So.